Hello to all our VetEmergency Academia viewers. We're diving deep into a topic that's crucial for every pet owner, veterinary student, and seasoned vet out there. Today, we'll uncover the intricacies of what your pet's breathing can reveal. Whether you're just curious or seeking advanced knowledge, this is the place to be. Let's get started. Respiratory distress is a critical emergency in animals, necessitating prompt intervention to pinpoint the root cause and to provide relief. Recognizing patterns of common respiratory issues in dogs and cats is essential for an emergency clinician. Respiratory distress can originate from various locations like the upper airway, lower airway, parenchymal, or pleural space, with common causes being anatomical abnormalities, airway collapse, pulmonary edema, infections, inflammation, and trauma. For an emergency clinician, the primary step is identifying the lesion's location. Using ultrasonography can aid in assessing pleural space diseases and cardiac chambers. In emergency situations, the key action is to offer supplemental oxygen and briefly gather the patient's history. Several methods exist for delivering supplemental oxygen, such as flow-by, face masks, and intubation with intermittent positive pressure ventilation (IPPV). However, for effective treatment, the cause of the distress, like effusion or airway obstruction, must be addressed. Signalment can provide hints regarding the disease, like congestive heart failure in Doberman pinschers or airway obstruction in brachycephalic breeds. Young animals might experience trauma or infections, while older ones may suffer from degenerative or neoplastic diseases. When stabilizing a pet, understanding its history is crucial, as some respiratory distress might stem from clear causes like trauma or subtle ones. Environmental factors, like heat stress on hot days, can exacerbate upper airway obstructions. Pre-existing conditions, such as cardiac issues or prior surgeries, can also predispose animals to respiratory issues. In cats, signs preceding respiratory distress can include anorexia, or unusual behavior, hypothermia, or overheating, often affects dogs with upper airway issues. This can be due to obstructions, which might be dynamic like laryngeal, paralysis, or fixed like tumors. Initial treatments for suspected obstructions include sedation, cooling, and supplemental oxygen. If no improvement is noted, more invasive interventions, such as intubation, may be needed. Coughing and wheezing are other common symptoms. While coughing can result from irritation within the airways, wheezing is typically a sign of narrowed airways. Coughing in cats often indicates airway diseases, while in dogs, it can be linked to chronic bronchitis, pneumonia, or congestive heart failure (CHF). Wheezing usually suggests airway disease in both cats and dogs. Are there extra lung sounds? Auscultation of the thorax can reveal louder sounds, or crackles due to parenchymal lung disease. It's hard to hear these in coated animals or noisy ERs. Common causes of this disease include pulmonary edema, pulmonary contusions, pneumonia, and neoplasia. Thoracic radiographs help identify the cause of respiratory distress. In dogs, cardiogenic pulmonary infiltrates surround the perihilar region, but in cats, the distribution may differ. Bacterial pneumonia usually has a cranioventral distribution. Neoplasia often leads to a nodular pattern, but metastatic disease varies in appearance. Other potential causes are interstitial lung disease, thromboembolism, and atypical infections. Cats with heart failure often show hypothermia, increased respiratory rate, and slower heart rates 130,140 BPM. Adult dogs usually have chronic valvular disease or dilated cardiomyopathy. Treatment includes furosemide, imibendin, and oxygen. Non-cardiogenic pulmonary edema can be triggered by upper airway obstruction, seizures, or electric cord injury. Its treatment hasn't been fully established, but most dogs improve within 2,448 hours. Pulmonary contusions, common post-trauma in dogs, need rest and oxygen for recovery. Pneumonia in dogs necessitates broad-spectrum antibiotics, physiotherapy, and fluids. Dogs with recent antibiotic treatments might have resistant infections. Metastatic disease symptoms include cough and lethargy. Treatment focuses on supportive care. Some causes of pulmonary infiltrates are eosinophilic, pneumonitis, and pulmonary fibrosis. What does point-of-care ultrasound show you? The addition of ultrasound in emergency medicine has been significant in recent decades. It's valuable for assessing the pleural space, cardiac structures, and lung parenchyma. Basic screening skills for ultrasound are quickly learned. For respiratory distress in animals, checking for pleural effusion and left atrial enlargement can be done bedside. Starting treatment. Thoracentesis can lead to clinical improvement, with samples saved for evaluations. What should I tell the owner? Respiratory distress is alarming for both the pet and owner. Solutions can be simple or require detailed diagnostics. A systematic method enhances outcomes. Clinicians should avoid suggesting euthanasia without a clear diagnosis, as many animals recover or can maintain a good quality of life. Thank you for joining us today on VetEmergency Academia. We hope this session has provided valuable insights into the world of animal respiratory health. Remember, every breath our pets take holds a story, and with the right knowledge, we can better understand and support them. If you found this video helpful, please give it a thumbs up, share it with your community, and don't forget to subscribe for more enlightening content. Until next time, stay informed and take care.